Do you want to see how a patient responds when they really take their health into consideration, when they work hard? Well, check out how much better this patient is and how much louder his adjustments are 2.5 years later. Hi, this is Dr. Ace Thayer, your YouTube chiropractor, presenting the best results on YouTube. Remember, this is part 5 of a 5-part series. This is 2.5 years later. Stacey can stoop to the ground effortlessly now. And if you watch him walk, he can walk so much slower and coordinated, which is very difficult for him. Check it out. I also want to know, what do you think of these 5-part series? Are they too long? Do you like this kind of detail? Let me know in the comment section. Love you guys. Hey, Dr. Thayer here with Stacey. This is, again, 2.5 years later. This is the end of 2 weeks. We didn't do a video last time he came in, or a couple times actually. And you guys have seen his first 2 videos. There's going to be a link in my description below that you can hook to those. They're a couple years old. Check those out. I mean, it is him. He had a beard before. He was fat ass before. So it's him. You can see the name and it says Stacey. That means it's him. So don't be like, that's not the same guy. Because you don't look the same, actually. Mm-hmm. Yeah, you don't look the same. So tell us how these 2 weeks have been. I mean, where are you at? We had actually some home runs these last couple weeks that we never had before. So tell us about this.
Right. So I usually come in with a few pain points that are significant, like upper neck pain, mid back pain. I've started out with heartburn that never came back, which is good.
I was looking right at the word when you said that.
Right. So, you know, and these in the last 2 weeks have been like, they're like from 5, 6s to 0s, 1s, 3s, you know.
The big thing with Stacey this time is that he's skinnier. No, I'm picking on him because I don't know what the frick's different. I've said this many times in some of these videos already, is that he's skinnier. Is it because he's skinnier? Or is it because his little frickin' neck is smaller? Or is it because he has better posture over time? I'm going to say better posture, but I just want to pick on him because he's skinnier. But I could get so much better adjustment. These are the best adjustments ever given on these last 2 weeks. I mean, he is moving so much freaking better. Mm-hmm. And so I'm happy with his progress. This is the most we've ever done with him, I think, and everything is going great. So I think that's why we took the next step. And again, when you do what I ask, you come back and your body's in better position, better place to get better treatment. Mm-hmm. But again, this has been unbelievable. I think it's a skinny neck, by the way. So what else have you learned this last couple weeks? Or what has changed? How about that? Other things besides this decreased pain? Anything else?
I mean, it's just better balance. It's been a little bit different, a little bit more of a fine-tuning with dealing with, I guess, a new body, I guess. That's the best.
He's not top heavy. The one thing I want you guys to pay attention to is when he goes down the hall, we're going to walk. That walking is like freaking unbelievably better. I mean, look back to the beginning. Unbelievably better. And the best thing I have from him is he can walk slow. The coordination of walking slow for this gentleman is very difficult in the past. He can walk slow. He can coordinate now. He can turn, and he does things so lightly looking. It was so heavy before. It was so laborious before, laborious, something like that. And so it's so much better. So I mean, when he walks, it brings a tear to my eye. I go, I did that. That was all me. Anyway, it's so much better. So much better. It's so nice to see him. Ready to get treated?
Yep.
Good, perfect. Let's put in the chair. Scoop it up. More. Let's see. And so, how did we do that adjustment this morning?
It was good.
A little different. You like that?
Yeah.
I think we'll do the same thing because I thought that was good. So Stacey's problem is that he, after 2.5 years, never knew how to sit. I finally taught him how to frickin' sit properly. And I don't think he wants to change, but he's starting to change already. The other thing is when he sleeps, which we've gone over this before, which you obviously didn't listen to me, he likes to sleep on his back or side, but he turns his head all the way to the right.
Yeah.
And I told him to go get a couple butt cheeks, put your head between the butt cheeks, and it won't turn. I go, okay, if you can't find butt cheeks, use pillows. So, pillows. Hold his head still. It's an old Chevy Chase thing, that's all. butt cheeks. No, not funny. Where are those hands? They were between two pillows all night. Those were pillows! Anybody can name that movie? Those weren't pillows!
There's no pain there, really.
You want the bad jokes? You're talking about the physical. Oh! I thought I may have hurt you mentally with those jokes.
That happened a long time ago.
Exactly. Okay, so we adjusted different today. We adjusted his, we've been adjusting the base of his neck, and that seems to be like so much better for him. But today, because he had slept wrong, he threw his hip out again. And so I adjusted him more in respect to how he slept last night. And I think you liked it. So we're going to do that again. You guys get to see that? Because he likes to turn, he likes to sleep like this at night. How's this feel now? Tight?
Yeah.
So this morning when I came in, I did this, he goes, oh, I feel so good. Because he had stretched his neck that way all night long.
Mm-hmm.
So I went like this. I go, how's that feel? He goes, oh, terrible. So I adjusted him to create that better balance. And so we're going to do that right now. You guys get to see me. I'm going to do a C1, C2 adjustment right here. It's trying to be C1. It's very difficult to get on exactly in the chair. So let's do a rotation here. Good, good. And so it's a little bit added rotation, not so much lateral flexion on that one. And that's to create proper range of motion, so the range of motion is better. Ding, 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 ding. Okay, good. Okay, now we're going to do a low C7 adjustment, because this is the one that's been helping him the most since he's been here. And so it's already starting to pop a little bit. And we're going to take some more tension out of this because he's Mr. Gumby. I mean, that was funny. I thought the butt cheek was funny. That was funny. Gumby was funny. You never know what's going to work here, you know? I just throw the jokes out. Just throwing them out. Just throwing them out. One's going to stick. You good? You need some time? That was pretty funny. Gumby was pretty funny. The New Zealander didn't get it. They didn't laugh at all, did they? Okay. Okay, let's go this way. Ah, wow. I didn't hardly go at all. I'm going to try that one more time, actually. Let me see. Maybe I just went a little fast. Good. Okay, here. Good. Yeah, that's it. Huh. That's the first time that hasn't gone.
Yeah.
That's the first time. Interesting. Okay, on your side. That is really strange. I mean, that thing went like every single time so much.
Yeah. Well,
Maybe that atlas rotation really helped more than I thought. Okay, so we're doing low back adjustment on him. On this side, we're doing an eye and ilium. This is back to my old Gonstead days. His hips are really, really rotated, so we always just unrotate him here. And the reason I do it on him, he pays me extra. No. No. 2.5 years later, we're doing some more advanced stuff on him. So this is an eye and ilium come under the hip right here. Good, right there. Good. Other side. Other side over here, I'm doing a PLS L5. And so here, there. Pull his ass over here. So I'm going to set up right on his L5 right here. Okay. That's right in here. Good, perfect. On your back. So, you know, it looks like I'm the most skilled neck adjuster ever, but I also freaking just low back's great too. You just don't see him all the time. Good. Good, perfect. I did his toes because of his bunions. Look at these ugly bunions. Look at this. Take a look at that thing. Whoop, whoop. Whoop, whoop. Yeah, they make noise too. Okay. Scoot down a little bit. Good. What we're going to do is clavicles also. Okay. No noise out of these things, but it does help a lot. And he loves this. Watch his face, by the way. Oh, he's gotta be tough. The reason I do these guys is because these clavicles, all the muscles from the neck attach into this bone right here. This is the foundation of all those, so when you loosen this up, it loosens all the neck up. And you can't guess what I work on. Neck! Good, perfect. That actually went a little bit. Mm-hmm. Want to sit up? Okay. So we're going to walk down the hall. I want you to just move slow and just see what you do. Okay? Mm-hmm. The other thing he does really well is he is more patient with his walking. Not just the walking, but also patient between his walks, which I'll show you when he gets to the other end. Okay, so watch this, zoom up on him, please. So what he does, we've done this with him, is that we get him back into better anatomical position so that his body is ready to walk properly. Before he used to rush out of this, and he wouldn't be able to just stand there and stop and do this. Now he stops, centers himself, and then comes. So take your time. So this is coordination is unbelievably better. Good. Unbelievably better. So go to the right, go to the right. Good. Okay, so I don't know. Anything else you want to add, Stacey? See you next year. End of the year, maybe. I don't know. We're going to see him next.
I don't know. Bending is easier too.
You want to bend for me?
Yeah. Not exactly the correct way to bend for most.
But tell us what the difference of that is compared
But
to
it's
before.
effortless.
How hard was it before?
Really hard. I mean, it was like.
Well, explain to us what was hard about it. You couldn't get back up. You couldn't go down. What?
Just maintaining balance. I was a little off balance there, but it's a lot less of jerkiness than it was.
Yeah. So the power or the coordination or the flexibility?
It's flexibility and coordination. It used to be very jumbled, very choppy. It's never been like up, down. It's always been like I need to brace myself.
Yeah, brace yourself for different things. Yeah. You didn't even hold the door or nothing. You just went up by yourself.
Right.
Any other positions that are different?
Not really. I mean, it's all easier. It's tough to pinpoint just one. It's all easier.
Yeah. So again, 2.5 years, good friend. He'll talk to you online also. I mean, if you want to leave messages on here, he's more than willing to talk about cerebral palsy, but anything, how this whole program works. He wants you guys to, he asked me to do the video because he wants everybody to see that he's skinnier. He actually said that first. Like, I lost 80 pounds. You want to do a video? No. But he really wants to show everybody what 2.5 years later looks like. It's not just that he got better in the beginning and there was no improvement and that's placebo effect that I convinced him to do all this stuff. He leaves for months and months and months, 6, 7, 8 months at a time, and then comes back and still goes, I'm still pretty good, but I want to be tuned up. Okay. Anything else you want to add, sir? Any other public service announcements you want to give?
Not necessarily a public service announcement, but if you really need some involved treatment, it really works.
Oh, well, thank you.
I mean, it's very much hard depending on how hard-headed you are, but
well, good. You didn't blame me. That's good. That's good.
No, but it's very involved. It's a lot of work. It's a lot of retraining of your processes and what you do in general. So it's really impactful if you do it right.
Let me ask you one thing, because everybody's probably curious about this. Why do you come back if I did such a good job? That's the question probably you're asking. I mean, let's answer the question.
No. I have a condition that is chronic, so it will pull itself out, and I do as much maintenance as I can, and once every 8 months is not bad. So.
Yeah. So people are like, if he's so good at what he does, why do you keep going back? Okay, so, but remember, people go to chiropractors every day, every other day, all the time. They live in their hometown. He only comes back about every 8 months. And so it holds pretty good for that. He has some issues, but we've taught him a lot of stuff, and he's able to mitigate those problems, and he holds his adjustment way better than you think.
Yeah.
So anything else, Stacey?
Nothing in particular. Thank you very much.
Yes, always good to see you. And we'll see him again on the video in the future. Thanks for watching, guys.